welcome to another Top Doctors online interview with one of our top specialists. Today, we are honored to be joined by Professor Philip Bloom, a leading consultant ophthalmologist who will be speaking to us today about glaucoma. Thank you very much for taking the time to speak to us, Professor Bloom. Would you like to introduce yourself, please?
Thank you for having me. My name is Philip Bloom. I'm a consultant ophthalmologist at Imperial Healthcare NHS Trust, specializing in glaucoma and cataract.
Okay, perfect. Thank you very much. So we can begin with the questions. So the first question is, what is glaucoma and what are its causes?
So glaucoma is a condition of the optic nerve. It's a disease where the optic nerve becomes less healthy. Most often, it's associated with raised pressure in the eye, but by no means always. There are other causes. It can be related to the use of various medication. There can be genetic causes. And it is a treatable condition as long as it's caught early.
Okay, perfect. And is it very common?
Yes, it is. Estimates vary. It's increasingly common as you get older.
Okay.
In the UK population, I work in the UK, it's estimated that it affects up to 2 to 3% of the population over 60, and over 70 or 80, perhaps even up to 10%. And about half of those who have the condition probably don't know they've got it. So it's significantly underdiagnosed.
Okay, interesting. Thank you. And how is glaucoma treated? And can it be treated without eye drops?
Well, the only proven effective strategy is to lower the pressure in the eye.
Okay.
In the past, we've done that principally with drops, and then we've proceeded to laser and surgery. But increasingly, there are safe and effective laser treatments which are used as primary therapy. So in the UK now, if someone presents with a new diagnosis of glaucoma or raised pressure in the eye sufficiently high that we want to lower it to reduce the risk of glaucoma, we now initiate laser therapy as the first-line treatment. Also, increasingly, we're incorporating surgical treatment for glaucoma as part of cataract surgery. So our aim increasingly is to treat glaucoma without committing people to a lifetime of having to take drops to lower their pressure.
Okay, cool, thank you. And how effective are these treatments, especially these newer treatments that you've mentioned?
Well, the lower the pressure, the better, really.
Mm-hmm.
And increasingly, these treatments are getting better and better at lowering the pressure. So we'd expect a laser treatment to lower the pressure by up to a third, and surgical treatments can lower it by up to a half. In the past, with less effective treatments, people have required drops as well. But increasingly, we're able to manage people either by laser or by surgery, or perhaps by a combination of the two, without the need to take drops as well, which is, of course, a great advantage to people's lifestyle, because taking drops can be a real nuisance. It can be irritating locally.
Mm-hmm.
And because the drops get absorbed into the bloodstream, it can even be a problem systemically. It can cause problems with their general health.
Okay, interesting. And so would it be not as easy, but is it just one procedure and then they don't have to worry about their glaucoma anymore, or is it that effective?
Yes, our aim is to try and contain the disease with the initial therapy. So if that's effective enough, it may well be that only one procedure is necessary, either a laser treatment or some form of surgery. Sometimes drops are needed in addition, but increasingly not always. And we always treat patients in a systematic, stepwise fashion. We do the simplest, safest things first. And if it doesn't work, or it doesn't work well enough, we go on to something a little bit stronger, if you like, a little bit more invasive. But again, increasingly, we leave the most risky, the procedures that have the greatest risk of a complication till last. And even then, those tend to be the procedures that have the greatest chance of success. So with appropriate management and in expert hands, even those procedures are generally very effective and very safe.
Okay, thank you. And can glaucoma be completely cured?
There are some forms of glaucoma that can be cured, especially if they're associated with a particular condition. For example, some people's glaucoma is related to the shape and size of their own lens. So cataract surgery, or cataract surgery with a small device to help lower the pressure, can itself be all that's required to treat glaucoma. Other forms of glaucoma may be related, for example, to various conditions, inflammatory conditions, and treating that inflammation can treat the condition. Some forms of glaucoma are related to the use of various medications, and stopping those medications or using alternative medications can be very effective. So actually, many forms of glaucoma are entirely curable. Sadly, the majority are not, but they are entirely treatable and manageable by various treatments. We've said either laser, drops, or surgery. And increasingly, we're getting better and better at being able to treat those conditions with very little downside for the patient, very effectively, and with minimal long-term problems.
Okay, thank you. And what could happen if a patient, as you said, some of them don't even know they have glaucoma. So what would happen if it was left untreated?
So glaucoma, if untreated, will progress, generally quite slowly, although there are sadly a small proportion of patients whose glaucoma progresses very rapidly. So generally, there's no cause for concern. As long as the condition is managed and monitored and treatments are complied with, the results are good. But if patients do not comply with treatment, if they, for example, are unable to attend their visits or unable to take their drops, sadly, vision can very slowly be lost. But again, even at a later stage, as long as something is done to intervene, the condition can be halted. So the progression of glaucoma can be halted at any time by appropriate intervention.
Okay. And if I was suffering from glaucoma, is there anything I should avoid doing or any special measures I could take to protect my eyes?
Well, there are very few lifestyle factors. Bluntly put, it's never anyone's fault generally that they get glaucoma. The only thing to add is that if you smoke, smoking, like for many other conditions, is not very good for glaucoma. So smoking cessation is one thing that you could absolutely do. And clearly having a healthy diet, having healthy lifestyle will help. But the only thing really you can do to prevent yourself having glaucoma is to have your eyes tested regularly and comply with any interventions, any investigations or treatments suggested by the healthcare professionals that are looking after you. And by that means, generally, most people's glaucoma can be completely halted in its tracks.
Okay. And when does it require surgery? At what point would you start to think, okay, these other treatments aren't as effective as we hoped, and you might need to consider surgery?
So in the past, surgery has been a sort of nuclear option, if you like, something that we had to do when there was no alternative. Increasingly, because surgical procedures are less invasive and safer, we're employing them earlier. So now, as I mentioned before, we're often performing cataract surgery in association with a very gentle, mild form of glaucoma surgery that can often nip it in the bud at a very early stage. These procedures are often known by the umbrella term of minimally invasive glaucoma surgery, or MIGS. So 10 or 15 years ago, surgery would have been not quite an admission of failure, but an acknowledgement that the treatments that we tried, both laser and drops, were not as effective. Now we're advocating surgery at a much earlier stage and very effectively to treat the condition and prevent its progression.
And would many people be suffering from glaucoma and cataracts at the same time? You mentioned that.
Yes.
Yeah.
They commonly coexist, cataract and glaucoma. Again, I think in the past we've underestimated the extent to which age-related cataract or other forms of cataract contribute to the development, the progression of glaucoma. So one of the sea changes, one of the real advances in the management of glaucoma is the acknowledgement that cataract and cataract surgery play an important part of both the cause and the treatment, the therapy for glaucoma. So they do very often go together, and equally, treating the cataract is often a very effective treatment for the underlying glaucoma and will often halt it in its tracks so that nothing else may need to be done.
Okay. And for example, I myself am quite short-sighted, and would that be a risk factor? Should I be on the lookout for glaucoma or cataracts in the future?
Yes. Short-sightedness is probably associated to some extent with open angle glaucoma, one of the most commonly noted variants, certainly in the UK. The converse is true of people who are long-sighted. Long-sighted people are much more likely to get what's called angle closure glaucoma, which is the form of glaucoma that can lead to very sudden and quite alarming rises in pressure. But conversely, because it's an acute short-term problem, if it's fixed, to some extent, angle closure glaucoma, if it's treated early, can have at least as good, if not a better outcome. So you're right, certain forms of refractive correction, refractive need are associated with different forms of glaucoma.
Okay, perfect. And lastly, is surgery recommended for everyone, or is there any group of people that you think shouldn't undergo the surgery?
Well, some people are more at risk of complications with surgery. People who have problems with the surface of the eye that are where the surface of the eye is inadequate, lubricated, dry eyes. Those people tend to have more problems after surgery, and may to some extent be more prone to infection after surgery. Having said that, that those conditions can be treated really very effectively. One thing I didn't mention is that when we treat someone, for example, with long or short-sightedness, as part of treating their cataract or their lens, we can actually correct the refractive error. So increasingly, we're able to correct people's need for wearing glasses at the time of a simple glaucoma surgery procedure. We can take a lens out, implant a minimally invasive glaucoma device, and also at the same time implant a lens that will correct their vision for distance and increasingly for near as well.
Well,
so it's part of the many treatments which we as ophthalmologists are now privileged to be able to offer our patients to not only treat their condition, stabilize their vision, ensure a much reduced risk of blindness, but also significantly reduce their risk of needing to wear glasses or contact lens, and actually potentially even lifelong.
okay, wow, very impressive. Thank you very much, Professor Bloom. That's all of the questions we have for you today. And thank you very much for taking the time to speak to us. If you would like to book an appointment with Professor Bloom, you can do so today at tapdoctors.co.uk. Thank you.
Thanks for having me. Goodbye.
No worries. Bye. Thank you.